I'm Dr. Allan Perel, and this is Conversations in Medicine. I'm Dr. Allan Perel, and this is Conversations in Medicine, a program bringing you the cutting-edge medical topics for the Staten Island and tri-state community. We're going to talk about vaccines tonight, and vaccines are crucial this time of year, how important they are to the community, some of the controversies that are going on, and really to give us a bird's-eye view of vaccines from a medical point of view and even from a cultural point of view and seeing what's happening. I have two wonderful guests who are going to speak to us about vaccines. I want to introduce Dr. David Kim, Senior Physician at Beacon Christian Community Health Center. He's an internist, Doctor of Internal Medicine and Pediatrics. Welcome. And Dr. Jesse Severamuto. And Dr. Jesse is someone I know for many years. We worked together at Richmond University Medical Center, as with Dr. Kim, and we affectionately call her Dr. Jesse. I appreciate you being here. She's an MD and a PhD. She does a tremendous amount of work at Richmond University Medical Center in the Infectious Disease Department and with the residents. It's a pleasure to have you both.
Thank you.
David, tell me, we know each other for many, many years. Tell us a little bit about your program at Beacon Christian Community, because we're going to get into vaccines in a moment, but tell us a little bit about what you do.
Sure. No, thanks again for having me. My wife and I, Dr. Janet Kim, who you also know, and I started a number of years ago a faith-based independent community health center in the northwestern part of Staten Island. In Mariners Harbor specifically, and we see people pretty much from all over the island now. We've been around, this is our 14th year actually of being around, and our faith has compelled us over the years to provide comprehensive health care to anyone, regardless of their ability to pay. We are a federally qualified health center, which means that we receive assistance from the federal government to help take care of people who may not be able to pay for their own health care. So we do all sorts of health services, such as internal medicine, pediatrics, podiatry, nutrition. We even have mental health and some other ancillary services. So we're pretty much a one-stop shop place.
That's super. And again, just for the public, I mean, they could always just Google your name
Yep.
and find out about the programs that you have in order to bring comprehensive medical care to everyone in the Staten Island community. And I'm sure you have people from outside of Staten Island coming.
We do, actually, from time to time. We have people who have moved off of Staten Island but still want to come in and see us. So we've been very blessed to have some really loyal people that want to keep coming back.
And we're thrilled in what you're doing.
Thank you.
Dr. Jesse,
Yes.
we're going to talk about vaccines.
Good.
And we have a wonderful audience. Our audience is very bright. They write me letters all the time. They have questions about things that we talk about. We're going to start always with definitions.
Right.
What's a vaccine?
I'll make this very simple. Vaccine is a substance that fights any disease. But in infectious disease, particularly we think of bugs, bacteria, viruses. Yeast and molds, I don't think there are vaccines for those, but mostly bacteria and viruses.
So there's some type of a substance that lets your body attack that and prevents you from getting sick.
That's correct. It is made out of something from the bacteria or the virus itself, either given live or attenuated, or some molecule in the bacteria or the virus taken as a protein particle or even a toxin. That is given to the human body, and the human body produces actively immunity against the particular organism or the bug that we are fighting.
So tell me, does it, and either of you both being expert in this, does it always work? Do vaccines always work?
Most of the time, yes, but sometimes it does not work. I can give you examples. Some people get the hepatitis B vaccine, but when you do their blood levels, they don't have immunity. Why are these people not producing? Nobody knows the answers to that.
It's based on your immune system and how powerful our immune system is. We just had a lecture this morning about how it even fights cancer. There are
Right.
vaccines for cancer. I do a lot of work with Alzheimer's disease, MS.
Right.
Those are vaccines that are maybe in the future coming.
I think
Yes,
it's also
David.
important, though, to know that it's not saying that just because a vaccine may not work for you individually, it means that you shouldn't use it or you shouldn't take one. The studies have shown conclusively over the years that, you know, when a group of people get vaccinated, even if it doesn't work for each and every single person, the overall effect is better than if none of them got it, or a minimum number of them got vaccinated in that same group.
So we're going to talk about, we'll go into a little bit of a controversial area. Who should give vaccines?
You know, this is a question I actually get a lot, because we have patients that come into the health center and say, hey, I want to go to my local CVS, or my local pharmacy and get a vaccine from them. I tell them, it's not so much who's giving the vaccine, but what kind of follow-up are you getting? I mean, pharmacists and other healthcare professionals are being trained now outside of the actual traditional healthcare environment to be able to give vaccines, but it's really not simply just about being able to mechanically give the vaccine. It's also about, does the person delivering the vaccine know how to assess for side effects, immediate side effects that can happen with certain vaccines? Do they have the ability to get help if in case there's a problem with a vaccine? Does the patient know who to go to in case they get a reaction of some sort, or if there's something that happens that's adverse? So it's not even so much who should or who shouldn't. It's really, for me, the issue is more how do you follow up to make sure that people are being properly assessed, for the effectiveness as well as for any potential side effects or adverse conditions.
And I agree with you. And again, not just being physicians, and not saying that, yes, we're happy that a lot of people are able to get vaccines through their pharmacy. The idea, and I'll tell you what, there was a senior doctor when I first started in practice a number of years ago, who said that giving the vaccines was a very pivotal time of the year for patients. And I said, why? He said, just giving the shot. And he said, I would take their blood pressure, I would make sure their blood work is up to date, I'd listen to their lungs and their heart and make sure that there was nothing there that was wrong. Did they go for their mammogram, their colonoscopy, are they up to date with things? And sometimes when you don't go to the doctor or a healthcare professional, that includes nurse practitioners, physician's assistants, sometimes going into the pharmacy and just getting the shot, and the injection, the vaccine, we don't like to say just shot, but the idea is getting the vaccine is not really looking at the patient. And sometimes you forgot to go for your mammogram, forgot to go for your blood work, or you remiss somewhat in other ways, and it really helped that patient long term with regard to their care. So that's my own personal bias with it. If you go to the pharmacy, that's fine, but then go to your doctor too.
Yes.
And I think the key part is not always going to your physician or healthcare professional, which is more politically correct today, when you're sick. Sometimes it's good to go there when you're not sick. Because if you're going there when you're sick, we're not going to talk about colonoscopies and breast exams and mammographies and all the things that we need.
Right, and it's why we really encourage our patients to come to us for vaccinations. And in fact, there are patients who, will receive options to do vaccinations, for instance, when their child is born in a hospital. And nowadays, a lot of people are pushing for vaccinations, particularly hepatitis B, to be given within the first couple of days in the hospital. And we have patients that will tell I don't know if this is good or bad, but they'll tell the nurses at the hospital, we'd rather wait till we come to our own doctor and have our own doctor give the shots within the next several days. So I think part of it too is also building up trust with the patients to make sure that they understand that as physicians, we can care for them and also be comprehensive in making sure that it isn't just about, as you say, quote unquote, giving a shot. It's really about the entire health process behind giving the vaccines in the first place.
So we're going to jump into vaccines. We said microbes, bacteria, viruses.
Yes.
And I wish we had a vaccine for everything.
Yes.
But we don't. And you have to sort of prepare the vaccine, and the CDC, the Centers for Disease Control, actually makes the vaccines for that year's strain of flu.
Correct.
That usually goes from the east to the west. So tell us a little bit. We're in flu season now.
Yes.
First question is it too late to get the flu vaccine? Is it the right time? And who should get it, who shouldn't get it? Tell us a little bit about the flu vaccine.
So the flu vaccine is kind of an extraordinary vaccine because this is the only vaccine you have to get every year. And it is simply because the flu virus changes itself. That's called mutation. And when the mutation happens, it's a different strain of virus. So what was there last year that was prevalent is the one that they produce the vaccine against, because they don't know what is going to be this year. So what is there this year is what they will make the vaccine for next year. So every year it's going to keep changing, and that is why you have to take it every year. Who should get it? Anyone should get it above the age of 6 months. And there are different types of the flu vaccine. And the commonest one that is used is the inactivated vaccine.
Which
and
means
the
it's dead.
That inactivated means it's dead.
Right.
But it's still the virus, but it's killed virus. And it's a quadrivalent virus vaccine that is given.
And that's just the name of the virus.
It's the name of the, yes.
So when I was looking up in the literature and looking about tonight, I was seeing that older patients, people over the age of 65, should get a different vaccine or different amount of vaccine
Yes.
than younger patients. So tell us a little bit about that.
Yes, those who are above 65 years are given usually a more potent form of the vaccine. And that is simply because as people get older, their ability to fight infections becomes weaker and weaker. In other words, their immune system becomes weaker. So for people or patients in that category, it's always better to give them a more potent type of vaccine that will boost their immunity better.
And that's the example we were talking about before. And David will tell us your experience with patients who get the flu, how bad it is, and we really want to emphasize that. If a 20-year-old comes into your office with pneumonia, we usually walk out with a handful of antibiotic or a prescription for antibiotics to take it home.
Right.
If a 90-year-old comes in with pneumonia, many times they'll go to the hospital and maybe won't even live through the event. It's a very dangerous event in older patients.
Right.
And the term that we use I deal mostly with neurology as a neurologist and as a neuroimmunologist, because I deal a lot with multiple sclerosis, something called immunosenescence,
Right.
which means that the immune system gets older and weaker. So that's why it's important to give a little bit higher dose.
One thing also is, to take into account is not only is that a natural process of getting older, but it's also a function of the fact that older patients tend to have more health problems, and those health problems tend to, affect the reserve of patients, and so physically they're generally potentially in places where a significant infection like influenza can really weaken them.
And it's not exactly vaccines, but tell us, David, you're really in the trenches seeing a lot of primary care. What happens if someone gets the flu? How do they know it? And how bad is it? Do people die of the flu? What happens?
Yeah, it's an interesting question, Allan, because here's the thing. We're so used to being in a vaccine-oriented world that we forget how bad it was before vaccines really became mainstream. I think about just the 2017-18 season, which is a season which obviously had flu vaccine in it. This is just last year. And I looked up some statistics, and actually in this 1 year alone, 49 million people got sick with the flu. This is with a vaccinated population. 49 million people got sick. 1 million of those people got hospitalized, and over 79,000 of them died. That includes about 180 children. That's according to the latest Centers for Disease Control statistics. And that's with the vaccine. Now contrast that to the 1918 flu pandemic, which alone killed 675,000 people in the United States and millions worldwide. Really goes to show how important it is to deal with this every year and get your vaccine, because flu is nothing to sneeze at, literally and figuratively. It is a disease that impacts multiple systems in your body. The symptoms may appear similar to a common cold, but people who have classic flu symptoms invariably develop significant fever, significant upper respiratory symptoms, cough or runny nose. But then they get horrible body aches, and in many cases, that all progresses into having significant difficulty breathing, such that they end up in the hospital, sometimes on a respirator. And Dr. Jesse and I have been at Richmond University Hospital many times and seen many patients that have been in the intensive care unit just because, quote unquote, just because of a flu infection.
So Dr. Jesse, tell me, we both work at the hospital, we talked about this. How do we protect our patients? I mean, does the staff need to take vaccines? What's the policy in a hospital?
Yes, the policy is that everyone who comes in contact with the patient has to take the vaccine. There is a deadline to complete taking the vaccine. After that deadline, anyone who is going to be taking care of the patient should be wearing a mask before they enter the patient's room. So if you do not take the vaccine, then you've got to wear the mask. That is the policy.
And epidemics have occurred in hospitals where flu has become rampant.
Yes.
And there are different treatments for it. So even if you're going to visit someone in the hospital, please, if you haven't had the vaccine, wear a mask. Don't visit them. You really don't want to spread this infection to other people. It's enough that we talk about common cold. There's no cure for the common cold. There's no treatment or vaccine for the common cold. But the idea is really with the flu, it's such a dangerous process. We really do need to treat it. And is there, as you said, from 6 months on, pregnant women, older patients, basically everyone, patients who are on cancer, who have cancer, or chemotherapy, should all be taking it. I have patients with immunological disorders, as we talked about. They all should be taking the flu vaccine.
Yes,
so
correct.
that's first and foremost.
And just to bear in mind, people who are having a very weak immune system or even pregnant women should not take the live vaccine. That is the important thing. The killed vaccine, anyone can take it.
And most of our vaccines are killed.
Killed, correct.
So now we're going to go into another controversial area. So the flu vaccine is pretty straightforward. We all should be taking it. Please, please, please take your flu vaccine.
And don't forget hand hygiene.
And hand hygiene. Washing your hands. And if you go into the hospital and your doctor doesn't wash their hands, nurse doesn't wash their hands, do not be ashamed to say to them, please wash your hands. It sounds like something silly you'd be afraid of, but most of us, sometimes we all forget occasionally. And the idea is it makes everyone feel comfortable. Somebody might have washed their hands outside, and when they came into the room, you didn't notice it. But please, if you're concerned, just ask them to use the various disinfectants that are in every room. It is so important. We can't say anything. I think about someone who goes into the operating room, surgeons, and if they don't wash their hands, think about what kind of things could happen. Right. Let's go over measles, mumps, rubella. And again, that's a controversial area. There's the idea of clearly taking vaccines are important because these are devastating illnesses. Measles has made a resurgence over the last year. And David, I'll have you start a little bit just about the importance of taking it. And we'll talk about the issues with regard to autism and the autism spectrum disorders.
Sure. And
what is the literature and what is the science behind it?
Sure. So I have a personal sort of vested interest in this because I have an autistic brother. And so this has been an area that's been sort of near and dear to me over the years because I wanted to make sure that, obviously for my own brother's sake, but also for my patient's sake, that we have the most accurate data that we have on the subject. You know, it's interesting because the whole controversy about the link between MMR, measles, mumps, rubella, and autism began with a small study of 12 kids by a guy named Wakefield in 1998. And it was published in Lancet magazine. It created this incredible worldwide sensation and scare. Obviously, a lot of people are still concerned about it. But it's interesting because subsequently in 2010, after there was a number of ethical improprieties found in the way that the research was conducted, the Lancet took the unusual step of recanting their article from 1998. Now, besides that, though, there have been numerous studies that have been done. The latest that I researched recently actually was this large 15,000 patient study in 2015 that was actually published in the Journal of the American Medical Association, which showed that there was absolutely no statistical link between administration of the MMR vaccine and the onset of autism. So I think the literature has been pretty clear in rebutting the original argument. Of course, there's still concerns that people have, and I think it's important for everyone, doctors as well as patients, and healthcare professionals in general, to continue to stay up to date on the data, look up information on the AAP, American Academy of Pediatrics, or the CDC. They have a lot of research, and they are constantly updating on the subject.
Yeah. I just have one thing to add to this. MMR, the vaccine itself, multiple studies have shown, as you said, that it's not linked to autism. But if you take the flip side of it, if a pregnant female gets rubella, then that child can be autistic. So if you don't take the vaccine and the pregnant female contracts rubella.
That's the German measles.
Yes, that is German measles,
right.
Yes.
And what's interesting, there's a term called herd immunity. And I think we talked about this and you've educated me about this, that most of the people, is that 95% have immune systems, immunity to a disease. Even a couple of people who might not have been vaccinated will be okay. But you can't rely on somebody else. Yeah. Tell us a little bit about, and maybe I'll go back to the flu also. Some people are always worried about a neurological disorder called Guillain-Barré syndrome. And we talked about the reasons not to take the flu shot, as you said before, is if you're allergic to eggs, because it's made through eggs, right? Is that correct?
Yeah, allergy to egg is not a contraindication to taking the flu vaccine, no. If they have like a simple allergy, hives, there's no problem. But if they have severe egg allergy, then it's better for them to take it in a supervised environment where there are facilities to do whatever they have to do immediately. The only contraindication is when they have had a severe allergic reaction to a flu vaccine itself. Then those people cannot take
And that's
it.
great. Thank you for teaching me. The egg story really doesn't hold anymore, because they
It
always
does
ask
not hold
everyone,
anymore, no.
if you go to, when you get your flu shot, they always ask you if you've had allergy to eggs.
Yes, so that is not so anymore. But you have to distinguish egg allergy versus allergy to the vaccine itself. These are two different things.
And diseases like Guillain-Barré syndrome, which is a neurological, immunological disorder, can occur, but at a very, very rare.
Yes.
And as you mentioned, David, the number of people who've died from influenza, even in the last year or two, are logarithmically more than the people who contract this disorder. So it really is a very unusual thing to happen.
Yes.
In fact, there are even some studies I believe that have even indicated that getting Guillain-Barré syndrome from the flu itself is more likely than getting it from the flu vaccine.
Exactly.
So definitely something to consider when you're trying to do your risk calculation between getting it and not getting it.
We're going to go through some quick things because we're running a little bit low on time. Other diseases that we treat with vaccines and what you think vaccines might come in the future. You mentioned hepatitis, and hepatitis is an infection of the liver.
Yes.
And I try to sometimes bring out to our wonderful audience, because everybody watches television commercials, and we see all these commercials for hepatitis C vaccines. Maybe you can give us, just in a few sentences, what hepatitis is, and there are different types, and the vaccines that are available, Dr. Jesse?
Yes, actually hepatitis is actually inflammation, damage to the liver. It can be from infection, it can be non-infectious causes. The common infectious causes are viral hepatitis, and there are different types of viral hepatitis. The common ones that we know are viral A, viral B, and viral C hepatitis. There are vaccines only for A and B, and these two are actually important. It comes also in travel medicine quite a bit, and beyond that, I mean, there are no other vaccines for any other type of viral hepatitis that we know of.
And there's treatments now that we hear about for hepatitis C,
Yes.
rather than a vaccine.
It's not a vaccine, but it's treatment against the virus.
Exactly.
So once you get it, you treat it, but there is no vaccine to prevent getting hepatitis C.
David, tell me, so I remember my children are a little bit older now, they're in their early 20s, that we used to have this book about which vaccine, when to get it, and that's one of the good reasons to stay with the same pediatrician forever, so they basically could see what were happening. Tell us a little bit about the cycle of vaccines and anything that really most people might not be familiar with. Sometimes you think that once you get to the age of 3 or 4, you're finished. What vaccines are really important and with timing-wise?
Yeah, so it's obviously, unfortunately, maybe in some cases, gotten way more complicated than it had been when we were all children. We didn't have nearly as many vaccines to have to keep in our minds back then. But it also, I think, goes to show the level of technology and research that's really gone into trying to create environments where we can really prevent these diseases from taking place in the first place. You know, the CDC, the Centers for Disease Control, has sort of a suggested guideline for giving vaccinations during the pediatric period, the time from birth to about 18 years of age. It's a long list of things. I won't bore everyone in the audience by going through it all. You can look up the Centers for Disease Control and find out for yourselves. But I will say that there's some very basic diseases that actually, before vaccinations came about for them, were pretty destructive to people and really caused a lot of mortality and morbidity. We think about diseases like diphtheria, tetanus, pertussis, hepatitis B, which we've done vaccinations now for universally. Measles, mumps, and rubella, we've just talked about that before, and people may not remember, but when measles, mumps, and rubella were not vaccinated against, we had severe brain problems and severe systemic failures, and people were dying very significantly from those diseases. Polio, we think about people getting shots in the 1950s, but in this day and age, polio still exists, but the reason why it's not that prevalent is because of vaccines. So diseases like diphtheria, tetanus, and pertussis, hepatitis B, MMR, polio, chickenpox now, more recently meningitis, with the new advent of the meningitis vaccine, and then of course the pneumonia vaccines. There are different schedules that different pediatricians will adhere to. They generally follow the CDC guidelines, so you should ask your pediatrician if you have any questions about the vaccine vaccines that your children are getting. Most vaccinations, according to schedule, should be done by the time a child reaches, elementary school age, around 4 to 6 years of age. And then there's ongoing vaccinations after that.
So Dr. Jesse, we both have children in college,
Yes.
twins, and they're both, thank God, doing well.
Doing well, yes.
And I feel like when I go to the dormitory to see my daughter goes to NYU, my son goes to Pace, I want to go out there and I want to see the list of their vaccinations.
Correct.
I want to make sure that these kids are up to date with the
date,
flu
yes.
vaccines. It's called meningococcal, which is a
Right.
kind of meningitis. Tell me a little bit about what your concerns are from once they become an adult, because people sometimes forget about getting their vaccines. And where do you go
Yes.
for that?
So once they have had all their childhood immunizations, most of them are lifelong. But there are some which you need a booster. The tetanus, you need a booster every 10 years. Hepatitis B is something very unique. If you have immunity, you have immunity, but sometimes they don't develop immunity, as I said. Then they could get the 3-dose vaccination again, and if they fail, they fail.
And you can
No.
tell by a blood test, can't you?
Yes,
So
you
that's how
do the
you're
blood test and see their, we call them titers, the levels of immunity in their blood. And so is it with chickenpox. Besides these, I mean, if they take good care of themselves, they should do well.
And wash their hands, of course.
Wash their hands. But there are other vaccines which I would just quickly jump into, because the routine vaccinations are there, but if someone is traveling to some place where they need extra vaccines. So for everyone in the audience, it's good to know that there is something called the CDC Yellow Book, and that gives you country by country what are the vaccines that are required for you to take.
And your doctor should, you should go to your doctor before you go someplace
Yes.
exotic.
Absolutely, and don't wait till the very last moment.
Right.
Don't go the day before to the doctor and say, I want these vaccines. There's no time, because the vaccine has to have time to be effective. At least 4 weeks ahead, you should go to your doctor.
And many of these vaccines are not generally available. They have to be
Yes.
specially ordered. So it really behooves everyone, if you know you're going to be traveling within, say, 2 to 3 months, to get in to see a doctor as soon as possible, so that vaccines may even be ordered if necessary.
Yes, especially the yellow fever vaccine.
Right.
Like, it's very hard to get that. Yes.
And most of these are covered by insurance.
Yes, it
Patients
is
are always
covered.
concerned.
Yes.
In our last very few seconds, I'd be remiss not to talk about the new shingles vaccine. Shingles
Yes.
is a devastating illness. As a neurologist, I see people with terrible pain. My kids barely don't even know what chickenpox looks like because of the chickenpox
Right.
vaccine.
Vaccine.
And shingles comes from a recrudescence or recurrence of the chickenpox vaccine virus.
Yes.
So tell me, Dr. Jesse, what do you think about the shingles vaccine? Who should get it? Who shouldn't get it?
Yes, so there has been a change in the immunization practice for shingles. It's much easier now. The previous time, it was for people above the age of 60. Anyone can get it. Even if you did not have chickenpox, you can still get it. You should really get it. So now they have a better vaccine, which is a recombinant vaccine. It's not live.
It's a dead vaccine.
Yes. So anyone can get it, and the age limit is 50 years.
So people over the age of 50 should get it.
Over the age of 50 years should get this.
And that's important because, I mean, shingles is a terrible illness, and we hope
It's very
day,
painful.
and we hope one day to eradicate that type of illness. I want to thank you all. I mean, right now we talk about vaccines and how important it is to get them. I think you've enlightened us the importance of seeing your pediatrician, your medical doctor, your internist about getting these vaccines, and not just to help yourself, to help your family, to help your community, in order, because if you get sick, other people get sick. Think about what happens at work if one person has a cold. There's nothing that bothers me more than someone doesn't cover their nose or their mouth when they're sneezing or coughing. And you think about how many other people are going to get ill. So if we could do anything in the world to make other people not get sick, in addition to ourselves, of course, that's really an altruistic thing to do. So please keep up to date with your vaccines. Don't think that somebody else will get it, therefore you're not going to get it. That's what's really important. So be up to date and take your vaccines. We're finished. Thank you.
Hey, thanks
Thank
so
you.
much.